so let's talk a little bit about what you can expect now. You know, we just did your surgery yesterday. You did amazing. You lost 11 pounds.
Yes.
But you don't step on the scale. People think, oh, I should step on the scale right after surgery to see how much weight I lost. Don't ever do that. Because you have, you know, when we give you IV fluids, the salt in the IV fluids retains water. And so you actually gain a little bit of water weight, and it can take a month to lose that water weight. Just from a few IV bags. So you don't want to get on the scale. And remember, I'm not letting you work out or anything like that because we haven't let everything heal. You know. And then with regards to your breast, they look amazing. They look symmetric. I'm so thrilled. It's incredibly satisfying for me. Yeah. Because you can notice it immediately. What was the first thing you noticed after all the anesthesia wore off?
I say after that or when I was in the recovery room.
In recovery, sure.
Yeah, that's why I cried. I looked down, like, oh my God, gone.
Yeah.
And the weight was off my shoulders. Yeah, I mean, you know, my back was, yeah.
You've had bowling balls that literally that you were carrying. I mean, that's a lot. Your back is like, I don't know what to do with
fix my posture sometimes. My body still slouches over, thinking it's still there. I have to do it.
Well, and be patient with yourself because you've had this for years, right? Decades. So the thing about the posture, that's why I did that collaboration with Blair Watson, the physical therapist, and it's on my YouTube, it's on my Instagram, but it's where we talked about physical therapy exercises and stretches you can do for posture that comes from leaning forward, primarily from breast reduction. I mean, from women who need a breast reduction. So large breasts can give you that posture, but so can just being on your phone, being hunched over a computer. So, or having had kids, and you know, you kind of lose that tone in your abdominal muscles, and so you kind of stand different and you hunch as a result. So, long story short, I have some resources on my website that I recommend, and of course, I'm happy to refer you to a physical therapist if you want. I totally recommend it. I'm going to see my physical therapist this afternoon at 4 o'clock for my neck. So you got to take care of your body. You know? And now that we did this, the thing in particular that I'd like for the physical therapist to do is the muscles between your shoulder blades, they've gotten overstretched. And so what needs to happen is she's going to need, not today, not for 2 weeks, she's going to need to stretch out your pec muscles so that you can open this up so that you can stand, instead of standing like this, you can stand like that. And she'll strengthen these muscles between your shoulder blades. And that's where, like, in the video I'm doing this, what you call it, that's kind of like a row, but the idea being that you're like pulling and you want to try and squeeze a quarter between your shoulder blades, which right now you could fit like dollar bills between them because it's stretched, so you need to get them strengthened, you know? So, anyway, do you have any questions for me?
I don't think so. Well, well,
shoot.
I have a lot of ABD pads. I don't need them, do I?
No. No. We do that in the beginning. We did that in the beginning because I like for you to have something in case there's a little bit of leakage of fluid. But you shouldn't be leaking fluid. We have the drains because, you know, we took off literally 11 pounds. I mean, over 2 kilograms from each side. And so that means there's a lot of space that could accumulate fluid, and I want it to seal down and stay where I put it. And I don't want fluid to build up. Just like if you sprain your ankle, it swells. That's your body producing fluid to try and help it heal. And your body doesn't know that I don't want fluid there. So once that output's low enough, I'll take it out. In the office. There's something I was going to say. But so you don't need gauze because I don't expect you to be looking at stuff. The other gauze, I want you to put it so that, like, if you think about how your drain's coming out at the end of the incision, I don't want, because we're having a tight bra to support and compress, I don't want the bra pushing that drain tube into your chest. So I want the gauze between the tube and your chest. Does that make sense? So under your bra band, so that the bra isn't squeezing it into your chest. Because that can just give you like a little pressure mark, and I don't want that. So that's why. And so I sent you home with some extra in your bag. Okay? That sounds good.
Oh, the other one was about, do I take this one off in a week? I know it was in the paperwork.
Oh, yeah, sure. I'm happy to explain. So I like for you to wear this bra that I put you in for a week continuously, and then you can order ones, because the ones that you can find online are just not going to be as tight. So if you can look online, I have my blog post where I talk about the different bras that you can order, and there's like ones for after breast reduction, ones for after breast implants. So I would get the breast reduction ones, get a couple of different kinds, different sizes. You know the bra size I put you in?
No.
Medium.
Oh yeah, she told me. I thought it was a large.
We were like so excited. Oh man. So yeah, you'll have to find different sizes because Amazon sizing. Who knows? I mean, I feel like someone just like pulls a straw and comes up with a random name. So try it. Make sure it's tight. It needs to be tight.
Needs to be
Needs
compressed.
to be
Okay.
snug. Yes, and you'll be in a bra full time for
Mhm.
6 weeks.
Okay.
And then after that, I'll let you go free.
Okay.
And eventually you go braless, which is something we've not thought
Never
about
did.
ever. Yeah.
Uh-uh.
Yeah, and so when you go braless, it's really important. Like if you ever do those like silicone nipple covers, which again
Yeah.
you've not thought about, but I'm sure you know of.
Mhm.
And so those silicone nipple covers are fine, but I have a video where I talk about like how to make sure you take care of them
Mhm.
because it'll trap bacteria under your nipple, and that's really dangerous. So
Yeah.
don't be like. You're like, oh, this person in high school or college wearing it out all night, wearing it for 24 hours, can't be doing that. So you gotta take it off, you gotta wash your nipple, you gotta wash the little nipple covers, okay?
Yeah.
And so that's just really important because everyone naturally has bacteria and on their skin, and on and about the nipple, there's a lot more bacteria there than on the rest of your breast skin because just like milk can come out, bacteria can go in.
Oh, yeah.
It's tiny little holes, like it's an orifice, a body, just like your mouth, your nose, your ears. Okay?
Now what about showering?
So I like for you to, with the drains, it's tough to shower.
Yeah.
So let's wait until you can sponge bathe and stuff like that starting tomorrow. But I'm not exactly excited about the showering with the drains, so I just have you
Yeah,
wait.
wait after. Okay. That's
Yeah, it's hard to keep that area clean. Yeah. And then when you do shower, I want you to let the water hit your chest. And I want you submerging in a bath, but like let the water hit your chest. Wash your hands with soapy water. This is why I like for you to not have like long nails,
Yeah.
because that's a great way to get an infection because bacteria just live up under our nails. So I keep mine real short too.
Yeah.
So you can cleanse. And so I want you to use warm soapy water. Don't be using like a washcloth or a puff or a sponge or anything. And just use your regular body soap. Don't use that chlorhexidine that I had to use before surgery.
Okay.
And then cleanse. Like get in. You can get your tape, your surgical tape wet. That's fine. And then just pat it dry. Don't run.
Okay.
Yeah.
That sounds good.
Awesome. All right, girl. I'm gonna see you next week.
Yeah.
Okay.
Can't wait.